I promote events now, and I was walking around the show, and all of a sudden I'm like, man, my back's starting to hurt a little bit. And next thing you know, I went to sleep, woke up the next morning, I was in Boston, I'm like, I'm gonna have to go to the hospital. Like, I could barely pack my bag. I was literally on the floor, and I don't know what, and when I sat on the plane, I had to fly to another appearance, and I was in so much pain, I had to literally stand up the whole time. It would spasm so bad. And anytime I sat, so I've been having problems sitting, but I feel great now because I've been to the chiropractor and they did tissue work, and I thought it's just something in my QL and my hips are off a little bit, but what I really need to open up is the hip flexors, you know, all my glutes, because I've been flying way more than I ever did.
Oh, okay.
So, and it's probably my psoas and could be some quad tightness, so I want to do an hour and a half of just get this all stuff loose.
This area.
I need to release it, especially because I think it's dragging on the back.
Okay. All
And it could be also the frontal,
the
you know,
hip flexors?
because I'm not stretching as much, honestly, and I don't get any tissue work now at all.
Okay. All right.
So what I need to start doing is doing some maintenance to try to see what we can get in there today and see what you feel. But it's this side mostly, and it was so deep
Was
in
it
here.
going in underneath the ribs? Like
It felt like it was so deep. Like when I walked, I could feel like
it was like pulling on.
Yeah, but to be honest, I trained legs today, and I actually felt pretty good. I front squatted but I feel really good. I mean, I've seen like probably 4 times like chiropractors. Not that they cracked me, but they did tissue work and just kind of adjusted my hips a little bit, and I feel great now.
Oh, okay. Well, we'll see.
But I want to get in there because I know she thought there might be a disc issue, where it's just kind of pushing a little bit, but until you get in there and feel around,
you know. We'll find it together. Yeah. What we do here is we utilize different types of equipment to help support the human body. And as we do it, we expose the areas so that we can get deep into realms that are usually not accessible from other points of views in here. So we use like an arch that will actually start to stretch the back out and expose the areas. Or we'll use these different types of equipment over here, or even we get in the floor for that matter and bolster up different areas. And we can get very creative on it. And we can put people in different positions, whether it's in a twisting pose or or even all the way around into the back poses, right? And to release things all the way from here on down. So that's some of the things that we do here. And we use the technique, or I should say the art and the skill of it, is to literally unwind connective tissue. So we literally spiral it out. And by doing that, you're actually unwinding it back to its original blueprint. So it's really, really cool.
So where people go into decompression beds and stuff like that, he's gonna decompression everything by a manual.
By manually doing it, and also actually physically unwinding the tissue.
You actually feel he does a motion, and it actually like you can feel the muscle just
pulls right out.
Just the fascia releasing. It's crazy.
How long have you been doing this?
Probably 25 years. Yeah.
And you have like tons of people flying from different countries, and
he flies over. He flies to Switzerland and does it.
Yeah.
What's the technique? What's your system? What is it?
Somoflow therapy.
Somoflow. Okay.
Yeah.
I think I've heard that before.
Yeah.
But he uses like chi, and you use
it's based off of martial arts.
Oh.
And it's from the internal, so we actually unwind from inside our bodies.
Wow.
I met him in the gym.
Yeah. I was going to ask you. Okay.
I met him at Lake Mead at Buffalo.
Yeah,
actually, like at 6 in the morning. He used to train
What, he
there.
came to talk to you, or what happened?
No, we just started talking.
Yeah,
and he was doing some stuff, and I'm like, man, what do you do? And
he was
that's how we kind of got linked up.
Yeah, he said, I'll try that out.
Lucky me.
I'll buy that for $1.
That's awesome.
All right, so how am I getting on this thing?
So go ahead and I want you to get on this way, Jay. Just put your pelvis right about here. And just let your head fall over.
He has to show me all the positions.
Yeah.
I forgot where I was.
Yeah, it's been a while.
It's been a few years.
Right?
So, and you have to wear like certain clothing for this.
Yeah, it's loose clothing.
He needs traction clothing.
So, there we go. Okay, now just let your knees fall in here, Jay. Just bring your knees down into the hole here a little bit. Yeah, keep going, a little more. There we go. Feel the stretch. The further you go down, the more you feel the stretch. There. So now this whole area is all exposed, and the weight of his legs stretches his spine out here. But he still feels supported in here. So that's what we're doing. And then, of course, I use, personally, because it's very powerful work. We actually have to use stuff in here. Now, you won't see a whole lot of me moving it, but he'll feel what's going on.
Yeah.
First, we just release all this area here.
I can feel this, Dave, in my, like he said, stretch it out.
You can feel that?
Oh
Yeah.
my goodness, it's like,
You're all bound up.
no, it's just like,
No,
I'm
it just-
compressed, bro.
Yeah.
It just shows, and if he's been flying for so long,
Yeah.
it literally just manifests deep into the spine right here.
It was like 8 weekends straight, I think. So.
Human beings are just not meant to sit for that long,
Yeah.
right? And it is deep work. Look, right there. You know that?
Yeah.
Yeah.
I used him for all my Olympia victories, even before I won. The comeback year, I saw him.
I can't believe I've never met him before. I'm surprised.
Well, it's
Yeah.
kind of, this is my hidden.
Oh, you didn't
Yeah,
want to
it-
give
it
all your
wasn't-
secrets.
Yeah, yeah. But that's the way it is, right? You
He
know,
doesn't have an office. He kind of, this is his. He's kind of like word of mouth, you know.
Yeah.
I was gonna. So you don't advertise. It says just like
Never.
referrals and people who
No.
know someone who knows
all
someone.
around.
Wow.
I just
You see-
every week.
He saved a lot of people from surgeries.
Yeah.
That's awesome.
And even people that came in for surgeries that had bad surgeries, they'll come to me. Yeah, we go.
That's the best kind of publicity if people just talk about you. You know.
Unfortunately, it only goes this far. In this little room.
You seem pretty busy though. So
Yeah.
yeah, he's been since he's retired. I think he kind of been slacking on the therapy because he was so big into it before.
Well,
That's make a difference.
It gave Jay
Really.
the ability
Yeah.
to do what he had to do.
Yeah, yeah.
Because
The edge.
building is just brutal on
Yeah.
the body.
Especially
It really
at that
is.
level, you know. Carrying a lot of weight all the time.
Yeah. Oh yeah. Feel that, Jay? Yeah. Now, literally, I'm opening up his spine, but I'm actually moving his rib cage that way, too, at the same time.
That's the side that hurts.
Yeah, right in
But I
there.
don't feel any pain right now. It's just
Yeah.
it feels tight.
It just feels very tight now. So they must have done,
Some good.
yeah. They got it to right there though, but I can feel that all right in there.
He's opened up that spine. Oh,
Yeah,
he's gonna make my back bigger right now, Dave.
it's actually in a way he's right.
You're gonna be wider when you
Well,
walk
yeah,
in?
it does. It does because it literally changes his because his natural structure is actually much bigger than this. It's just it's compressed,
Yeah, yeah.
and so by opening up all this connective tissue in here, it'll actually balance the muscles back out to the original size. You know, because you always have a favorite side when you're training, no
Yeah.
matter what,
Yeah.
right? So the other side's trying to compensate, and sometimes it gets hyper tensed,
Yeah.
like right here, and he feels it.
Oh, it takes my breath away. Oh,
Oh, I bet you just say that to everybody.
I'm a big charmer.
And that's part of the lung muscles is right in there. So that's what he feels it when you're doing that. Of course, this side here is actually the more of the situation that's imbalanced is in here by the lumbar.
Let's say you readjust someone and they're pretty well balanced, and you know, like you did a good job. And well, how would you say? How often would you say the maintenance should be or could be just to stay healthy?
The funny part about it is this stuff is so long lasting. Sometimes I don't see people for years.
Really?
Yeah.
Okay. Like him.
Yeah, like
and,
Jay.
and now he's back. Yeah. Oh, that's good.
I mean, you can always improve.
Yeah.
This work here is always about improving. Yeah, feel that right there. Is always improving. There's no boundaries to it.
Right.
It's just you just keep progressing further and further. There you go. Jay.
I was very dedicated.
He
though,
was
right?
dedicated, boy.
I
He,
Every week I came.
yeah, he would come and he just, yeah, okay, let's do this. Oh, let's change this. Oh, I can see this muscle not working quite right over here. Okay, we move it, and then all of a sudden it would balance out. So when you go to flex, it wouldn't show up like this. It would show up like this,
Mm-hmm.
right? So he was working that symmetry in there because scar tissue will unbalance. You can see it on people, right? People flex their stomach. You see the abs up on this side and down on this side, right? But those are twists. Those are things that are expressions in the human body on an internal basis.
Mm-hmm.
Ugh. Are you training still or
I am. Mhm.
where?
Well, I'm not training anywhere. I train at home now.
Okay.
I'm still training
So
martial.
do you ever leave your house?
That's
Are
a
you
good
a
question,
Are you
Jay.
a worse hermit now than before?
My
What'd she
wife,
say?
not much. I am
She heard that question.
I am a hermit.
Saving money for gas.
I know.
Yeah.
I know. Alright, so what are we releasing right here?
We're going into the QL now.
Yeah, which I was told that was an issue of mine.
Well,
Ooh, ooh, yeah.
we'll see.
You used to work this a lot for me. Oh,
Who?
you used to work this a lot.
Oh, yeah, yeah. There you go. Wow, that's releasing nicely.
My muscles were always pretty good at
They're always
responsive, right?
because you have such a you got a great diet, so glycation
And
is
I'm
not a,
hydrated. I stay very hydrated, you know?
but the glycation there's hardly, if anything, there's hardly any glycation in your tissue because it's clean. So it's easy to move your tissue actually, more so than someone that comes to me that's 67 years old that doesn't do anything. There we go. This area right there, right? That's good. There we go. Good. Let's bring it down. Now, mind you, I only weigh 155 pounds. Okay. He weighs twice the size. He's a big boy. Okay. So where do we feel? Sensitivity there.
Yeah,
How about there?
not as bad as
Not
that.
as bad as this one, huh?
But that's the smaller leg. Remember, it was always tighter.
This is the one, yeah. This is the one that,
Yeah, it turns out. I remember I casted it when I was a kid.
yeah.
So the hip.
Yeah, it was all in his knee. That was
Remember the
probably-
adductor was all tight.
It was
and
just
turning,
so super tight in here, it would just pull all the way up into his groin. We did some pretty crazy stuff to get that open up in there.
Brought out a lot of detail though.
Yeah. But,
I feel
It
that. on
kept
my-
you going.
I feel that on my back already.
do you?
Yeah.
Yeah. If I do that, it's okay.
Mm-hmm.
Mm-hmm.
You know, if you had a hose and you had something stuck and it expanded the hose, that's what this really feels like. And you're pushing it down to empty it out.
Like a toothpaste.
Yeah, like literally, it's like clumped up, and you're just pushing it to an opening to expel it.
Doesn't sound good.
But there's like a knot, right? He's on the knot.
Right there, right there.
It's hard to explain the pain. The pain is almost a tired. It's not pain, like where it hurts. It's almost like, the muscle's just exhausted from being in that position where it's just
Yeah.
like this.
I know.
And when it finally starts to release, it's like, oh my goodness, does the muscle have any feeling at all? Because it's been like that for so long. I mean, when muscle's like cement,
Yeah.
there's no blood flow going to that muscle, right?
So
But
true.
this is now gonna open up and get that blood flow in places it may not have been in for years, you know?
And then all of a sudden the nutrients can get into the area and repair it the way it's supposed to be repaired.
Yeah.
We call it angiogenesis.
For some reason, I thought she was French. For some reason, I don't know.
No.
I remember when you guys got together.
She sounds French sometimes when she
Yeah.
speaks. Yeah, that's right. You were around when that
Yeah,
happened.
before
yeah.
she was in it. You told me, oh, I met this girl.
Yeah, yeah. We got a history together.
Spent a lot of time on his floors.
You talk about something.
A lot of locations, you know.
Yeah.
But I'd have trouble getting in here. Like, I texted him yesterday, and he's like, okay, I have an opening tomorrow. Then back in the day, it wasn't like that because he had just a crazy schedule, you know.
Yeah, it was pretty.
He was like hustling, you know. I'm sure he's choosy now.
It was a lot of people back then.
Yeah.
Are you limiting yourself to a certain amount of people per day now so you don't work too much, or
Yeah,
Yeah.
I'm 60 years old.
What days?
well, you don't
go-
look it?
But you used to take certain days off, on Mondays or something last time.
Yeah.
Tuesdays.
Yeah, I
or
still do. I still do
the
Mondays,
weekends,
but
or-
well, no weekends
Sunday.
now. Still Sundays I take off. Yeah. But when I had an office in Switzerland, I was working 7 days a week
Oh, wow.
for like 21 days with all the Europeans.
But we'd have to plan my schedule like 2 months in advance.
Uh-huh.
I'd always say, okay, this is my day off, right? Because I knew my days off. So it'd be like, okay, I can come on this day, you know.
Yeah,
And very rarely did he cancel.
yeah.
I don't know if he ever did, actually.
No, I probably didn't. Now you were in a kind of an acute state in it, but now, yeah. Now just go ahead and
Much
kind of,
better, yeah.
do that for me. Okay. Just hold here. Concentrate your mind down on your foot over here, and just keep it there like it's anchored. Now just breathe from here. That's it. I got you right here. Okay. Breathe here. There you go. That's it. That's it. Again, relax. Just hold it. That's it. Relax. Good. Again. There you go. Good. Keep your foot down there. Uh-huh. Good. Come back up. To the side. Good. Deep breath. Breathe from here. That's it. Keep relaxing in here. That's it. Just keep relaxing there. There you go. Soften it more. There. Good. Keep your foot down. I got you here. You're not going anywhere. Beautiful.
I'm a new man,
Nice.
ready for the comeback.
So,
Yes.
Glenn,
Yes.
we're gonna put your information so people can contact you. Your Instagram, you have an Instagram, so we're gonna put that in the video. How long would you say people need to contact you in advance to get an appointment, like on
They're
average?
usually anywhere from 1 to 2 weeks out.
Good. Okay.
Alright.
So based on how busy you are, 1
Yeah.
to 2 weeks at least.
Yeah.
Very nice. Cool.
Yeah. Okay.
Very nice. Thank you so much for having us today.
You know, the therapy is SomaFlow method,
Somoflow method.
and it's like anything out there you never felt or experienced. It really is a feeling experience to get the work done,
Yeah.
and you can feel changes right away.
Yeah. Once they see this, I think it's be pretty different and special for sure.
Yeah,
So,
definitely.
thank you so much for having
Okay.
us in your home today.
All right,
We really
thank you.
appreciate it.
Most welcome.
Thank you.